For this technique, a double row repair is performed using the Why Not RC self-punching all-suture anchor and poplok knotless suture anchor. Then, the augmentation is performed with the allopatch HD. Allopatch requires no rehydration and is ready to use off the shelf in minutes. First, prepare the footprint and subacromial space using a ConMed dual-purpose shaver blade and the Edge bipolar arthroscopic RF device. Then, measure the tear size from anterior to posterior and medial to lateral. Then, cut the allopatch to size and round the edges. To begin the repair, the Why Not RC anchor is inserted past the primary laser line. Pull back on all suture strands to set the anchor firmly against the cortex. Next, a second anchor is inserted. The Why Not RC anchor contracts vertically and expands laterally to provide 360-degree form-fit fixation. The Spectrum Auto Pass suture passer is used to pass 2 sets of mattress stitches from each anchor. AutoPass reliably passes suture in thick tissue and gives the surgeon the option of capturing the suture in the trap door or releasing the suture in the joint. Then, 1 set of mattress stitches from each anchor is tied using a sliding knot. Next, a poplok punch is used to create a pilot hole for the first lateral suture. 1 suture tail from each knot is loaded into a 4.5 poplok anchor, and the anchor is fully seated in the pilot hole. After tensioning the suture, the anchor is deployed. This process is repeated for the second poplok anchor. The suture tails are left uncut. Next, a Spectrum 2 with Super Shuttle is used to place 1 anterior and 1 posterior stitch in the rotator cuff. Then, all sutures are pulled out of the lateral portal and passed through the allopatch HD. Stick knots are used for the anterior, medial, and posterior sutures. The graft is then introduced through an 8mm cannula and placed onto the rotator cuff. The sutures are tied and cut, and the augmentation is complete. Performing massive rotator cuff repair with the allopatch HD can potentially increase your success rate from 40% without augmentation to over 85%.